All right, welcome everyone. Thanks for joining us today. Sean Brewster and Bo Ledden talking to Tino D'Angelo today about the differences between acupuncture and dry needling, and maybe a little bit about the division with acupuncture and dry needling, which unfortunately still exists today. Tino, welcome. Thanks for joining us today.
Thanks, Sean. Thanks, Bo.
Tino, for those who may not know you, would you mind just giving a quick introduction about who you are, what you do, and why maybe we've asked you to join us on this topic today, because you are a subject matter expert for sure.
Thanks, Sean. So I'm a musculoskeletal therapist, and I am an acupuncturist, Chinese herbal medicine practitioner. So clearly, foot in both camps. I suppose I've practiced for a long time, rather, in integrating the two, and that I spent most of my career there. So I do recognise the differences between the two, and then there are some similarities as well, but predominantly practice in the area of musculoskeletal therapy and manual therapy, so musculoskeletal injuries and in that field. So
great, okay. And so Tina, you've been a great advocate and a bit of a pundit when it comes to talking about the differences for dry needling, because you've got, like you said, a foot in both camps, and you can with confidence and knowledge say, well, here are the similarities and here are the differences. But historically, there's been a real, I guess, a bit of a division between these two modalities, these two approaches, especially from the Chinese medicine acupuncture camp, where we often hear, rightly or wrongly, that acupuncturists believe that dry needling is nothing more than a watered down, diluted version of acupuncture. And it'd be great if you could talk to that for a minute or two to start with.
Yeah, I think my thoughts are that it started way back in 1977, right? So that's when Ronald Melzack made a statement saying that 71% of acupuncture points actually correspond with trigger points. And personally, I think his statement was incorrect. There's a category of acupuncture points which we call Archer points, which are simply tender spots. And so his statement would have been more correct if he would have said Archer points rather than acupuncture points. And so, that his research paper has been cited many, many times, hundreds of times in the literature, in other research articles. So that's clearly contributed to the grey area. So automatically, we've got, Western medicine practitioners and practitioners in the biomedical field, including manual therapists, thinking that, acupuncture's at least 71%, the same as trigger points. So I think that's where it all started. But, there's still, on both sides. So then the acupuncturists think that it's the same thing as well. And, all of a sudden you've got World War III when you mention, dry needling in a room full of acupuncturists. It's like,
absolutely. Yeah. And it's interesting, like for the general public, from the outside looking in, they see somebody inserting a needle into a body. You could be forgiven for thinking they are the same thing from a layman perspective. The challenge we have as healthcare practitioners is where we have different educated health practitioners still believing that there are similarities, or that one is, like I said before, a diluted version of the other one. So and I guess for the most part, in my experience, it's been Chinese medicine practitioner acupuncturists who've had a bit of an opposition to dry needling. And I think that you're absolutely right. The research and how you can take one piece of information and quote it over and over and over again in different contexts, people lose the context of what it's about.
correct.
And while there might be
real.
that's right, there might be some similarities about where we find where we find acupuncture points, and where we sometimes find trigger points, because they're not always exactly in the same location. That simple fact doesn't make the two things the same.
Correct. Yeah.
And that's, I think, where people may have gotten lost. So that's an important point.
Yeah, that's right. And it's interesting you mentioned the general public. I mean, to the general public, the two things, that they're needling, both modalities needle, and then, there's exactly the same filiform needle that's being used. So to the general public, well, isn't it the same thing?
Yeah.
And then even, so we're all involved in teaching students, and students often, I mean, that's such a common question: what is the difference between acupuncture and dry needling? So it's a gray area for everybody unless you've really got that specific knowledge on both. Then it's very, very difficult to tell what's different about it. Yeah,
Absolutely. Yeah, it's so easy to get caught up in the similarities when, like you said, unless you've got knowledge, you won't recognize the fact that an acupuncturist spends 4 or 5 years learning that modality, and a person dry needling doesn't just learn it in a weekend or in a short course. That's not. There's this underpinning knowledge of musculoskeletal anatomy, neurological, vascular anatomy, pathophysiology, all of these other things that we have to learn before we can then learn how to put a needle in.
that
And
is
so it's not
correct.
just a
Yeah.
short, it's not just a weekend course that someone picks up and can do at any time. There's a lot more to it than that.
And that's the common misconception from the acupuncture side of things. So often I hear, oh, look, they do a weekend workshop and then they're qualified to stick needles in. Well, yes, that's true. But like you've explained, there's all that underpinning knowledge that has to be learned before a practitioner, a manual therapist can stick a needle in, because there's all of the local anatomy that needs to be learnt about, the neurovascular anatomy, endangerment sites and lung fields, and all of that. One simply can't just learn needling without having that underpinning knowledge. So and often it's myotherapists, it's physios, it's osteos, it's chiros that do dry needling, and their anatomy is excellent. And even when we're talking about remedial massage practitioners, okay, well, their basic training really doesn't equip them with quite the same level of anatomy as, say, an osteopath would have, or a physio. However, this is where courses like your course, Shaun, include the additional anatomy that they can brush up on. So there's always a standard before they can stick needles in.
Yeah. So let's talk a little bit about the underpinning science behind dry needling for a minute. This is a great one to throw to you for, I think, because this is really your bag. And then Tino, if you can put on your Chinese medicine hat for a moment and talk about the underpinning principles and concepts that form the foundation of acupuncture, because I think that'll be a really good thing to highlight for someone who might be watching or listening to this who doesn't really know about either, and are thinking, oh, I don't want to learn dry needling because it seems too complicated, or I don't want to learn acupuncture because it seems too different to what we're doing. Let's give the audience a little bit more perspective about where this comes from. Bo, do you want to just talk a little bit about what we're doing when it comes to needling with a dry needling perspective?
Yeah, well, I think the first thing, as Tino spoke about before, that we really need to have that good underpinning knowledge of anatomy and some really sound clinical reasoning as to why we would apply a needle. We don't just put needles in for the sake of it. There's got to be some sound clinical reasoning behind that. And we think, well, why is that particular spot painful? All right. So we think, well, if we can press on a spot, what is causing that pain? So we can have peripheral drivers, we can have central drivers. But if we look at, those sensitization of the nociceptors, so where we have this upregulation of these biochemicals at the site of a myofascial trigger point. So increasing these in inflammatory substances that can sensitize the nociceptor peripherally. Now, the longer that persistent source of nociception is there, that can cause central changes. So we've got potentially a peripheral driver, let's say a trigger point in the deltoid, that causes, if that's persistent, that can cause changes to the dorsal horn, where there's upregulation of these pro-inflammatory chemicals at the dorsal horn. Then that can lead to some more central changes and persistent pain states. Now, when we think about that, well, yeah, there's peripheral drivers, there's potentially central drivers. This can increase the attention to pain, and we integrate this into the whole sort of complexities of pain. There's a lot going on there, and when we think about what's happening at the site of a myofascial trigger point, we're looking really from a pathophysiological point of view. If there's sort of a local contracture that leads to limited oxygen and limited blood supply to that area, that can increase the pH. Decrease the pH, so that area becomes more sensitized. Now, when we think about applying a needle to that area, we're really looking to increase the local blood flow around that area, increase the oxygenization, and improve the health of that tissue there, which can sort of create a bit of more of a dilution effect. All right, so there's less sensitization of that nociceptor. There's then less peripheral or nociceptive afferents to the central nervous system. So ideally or theoretically, the sensitivity can decrease. So if we can change what's happening peripherally, then ideally we can change what's happening as far as that input to the central nervous system. And there's always going to be, then changes in motor output as well. So, when we use dry needling, I think it's important to understand that we can address that from a pathophysiological point of view that could potentially decrease a patient's pain for a period of time.
Perfect. And so that's going to be vastly different. I'm going to predict here, Tino, that's going to be vastly different to a Chinese medicine perspective of why you would insert a needle. And I hope that the acupuncturists, the Chinese medicine practitioners that are watching or listening to this can hear that and go, right, well, that's different. That's different to what we do. And both camps should see that difference and respect one another for it. So let's dive into the TCM. For those who are not familiar with how acupuncture works, let's walk through some of the principles and the underpinning foundational knowledge that it goes into someone having or receiving an acupuncture treatment.
So yeah, there's many areas we could really discuss, but say taking Bo's lead there and sort of discussing this, a site of pain and then the central effects from that. An acupuncturist would probably look at those central effects and look at how they're presenting. So we look at our diagnosis is in terms of imbalance. So so if this person was treated biomedically, so was treated in terms of manual therapy, they'd be treated with the key word being their trigger points. I mean, trigger points are central to myofascial dry needling. So mechanistically, so one would needle the trigger point. Okay, so the manual therapist. But then from a Chinese medicine perspective, so this may or may not, deal with, I suppose, the plethora of the central changes. So those central changes that you've spoken about, Bo, are really about pain, right? But these could lead to, say, mental, emotional issues. So that's where the Chinese medicine practitioner would come in terms of balancing. And so, we speak about qi and we speak about, energetics essentially. And so Chinese medicine deals with balance. And there's a lot of metaphor in the way that we sort of discuss things. But ultimately, Chinese medicine does deal with, neurophysiological changes and signaling. There are lots of MRI studies, for example. You put a point in a needle in a point, say, in the hand, and then we look at the different areas of the brain that light up. And that's in the quest to explain what we're doing from a scientific perspective. But ultimately, we're looking at regulating the energetics of the body. And this sometimes relates to mechanistically, like in terms of mechanical disruption. But most times, so we're talking about pattern differentiation, so different patterns in Chinese medicine and balancing those out. And this is where the study goes into, so with the length of study is in Chinese medicine. This is why it takes 4 or 5 years to study Chinese medicine, because really it's about diagnosis. And it's making our unique style of diagnosis before we put needles in. So to simply put one needle in, it's unheard of in China. Well, there are different styles of Chinese medicine, so I shouldn't say unheard of, but it's very rare that a Chinese medicine practitioner would only stick one needle in. And the key word there is balance. And this is where it can kind of get a little bit sort of out of hand. You know, say, for example, there was a dry needler, just to say this, dry needler that thought, okay, so I can put, you know, the person's getting headaches and you know, I'm gonna dry needle suboccipital muscles, maybe trapezius, and then hang on. So I know that there's acupuncture points, you know, one in the hand and there's one in the foot. I might as well stick those in as well, because I can put needles in and they're good for headaches. Well, this is where, because so your manual therapist does not understand the term, you know, in terms of balance. Like, there's no understanding whatsoever. Whereas, you know, that's where all the length of study, when you're studying Chinese medicine, that's what it goes into. It's the fine balancing of key points and what to use with what. It's not simply a prescription like you look at, you know, an acupuncture book and say, yeah, these points are good for headache. Yeah, we'll use these points as well.
Yep. And that I think, Tino, is a perfect lead into where a lot of the problems come from in the way dry needling is taught today, and how it's led to some division in the two camps. Because we see people teaching dry needling courses and then they blend in a little bit of Chinese medicine. So it'd be someone like yourself who has studied both things, and maybe an osteopath and an acupuncturist, for example, and they'll go, well, let's throw in a few of these points that are really good for knee pain, and this one's really good for headache, without any of that clinical reasoning. There's no diagnostics that have gone, no TCM diagnostics that have gone into the selection of those points. It's based purely on the fact that point, gallbladder 21, is good for headache, so I'll use that when someone has a headache, even if the headache is caused by a cervicogenic cause or an allergic reaction or something else. And I think that's a watered down version of acupuncture.
Yeah.
You know, if we're talking about dry needling being a watered down version of acupuncture, that is the ultimate definition of a watered down version of acupuncture. It's taking something that requires 4 or 5 years of study and all of its diagnostic reasoning, and then pulling out little pieces for convenience and just teaching those because they fit nicely into a dry needling model. I think that's where really the source of the problem is. It's the muddying of the water. Would you agree with that?
Yeah, and I think all of us here today, as you know, all three of us know that there are those courses out there that actually do muddy the waters. You know, and so really, ultimately, you know, course like your course that specifically, you know, says what dry needling is so important to get the education out there that's, you know, clean and correct. You know, I think it's incredibly important.
Yeah, and I'll just add into that, like the different approaches, like when we look at it from a myofascial dry needling point of view, where we might use the dry needling as the tool to reduce their pain. And then we integrate that with maybe some pain neuroscience education and some exercise and movement and, you know, that whole education side of things, which I'm sure is exactly the same as what occurs in acupuncture, but it's sort of that slight different perspective. So, we can't say that we're just going to needle this point, an acupuncture point, and then blend that with a Western approach.
Yeah, so. Correct. And the key point being there, Bo, is that you're sticking to your modality.
Yeah.
And I mean, you know, probably just to elaborate a little bit on one of the things you said earlier, it's kind of like, you know, so if someone, like a patient comes in and, you know, and I get this often as well, so they want dry needling and you know, I've got, say, I would just stick with traps, you know, really tight traps, and you know, you assess that, you know, do a palpation assessment and there are no, you know, taut bands, there are no trigger points, but the patient wants to be dry needled. Well, it's like, well, you know, I'm not going to dry needle you because there's nothing to needle really. So, that diagnostic aspect is so crucial. It's so important.
Yeah.
On
You
both
mentioned
sides.
before, that there's been probably a change in Chinese medicine to integrate a little bit more of the neuroscience and the understanding of these central processes and stuff. When I was studying some Chinese medicine years ago, there was none of that in it, or at least not to the level that I went to in it. And I think that change in understanding for the Chinese medicine community about a little bit more of what we're doing, maybe with the myofascial work and the Western medical model, is brilliant, because it now creates a bit more depth and breadth to the modality, rather than the same issue that dry needling has, which is we just have a very narrow approach. We understand the nervous system, the mechanical system of the body, and the structure, and then we treat that, and then we integrate some of the psychological and emotional side of it as well, of course. But this is the thing where I think a lot of the confusion lies, is dry needling itself is a very narrow practice, but we have a very broad foundational understanding of the body as a manual therapist that we place that on top of. An acupuncturist has a very broad understanding of all of these things. And so to take dry needling out, or take needling out and say, well, that's a standalone modality, you can't really do it with acupuncture, because it's part of a much larger framework.
Correct. Yeah.
Yeah.
And I mean, so is that to say, acupuncturists can't dry needle? So my answer to that would be yes, up front.
Okay.
They can needle our Sure points, but their approach is very different. So they're dispersing. I mean, it's a very similar approach. So they're dispersing that essentially that tender spot, or that nodule. But the understanding, that trigger point pathophysiology, that understanding is not really there for acupuncturists. And so I think it's equal on both sides of the fence. I mean, for an acupuncturist wanting to, specialize in manual or the sort of musculoskeletal approach, and wanting to work with trigger points, I think that additional education would be crucial. Just because they're acupuncturists and they stick needles in, that's what they do for a living. It doesn't mean that they can adequately treat and safely treat trigger points, because they would need that underlying anatomical knowledge, I mean, for starters, but then also that, pathophysiology, all the things that you were talking about earlier on, Bo. I think that's really important.
Yeah, definitely. And that, when we think about that whole pathophysiology side of things and what we're trying to achieve, it's really about us trying to clinically reason why we would choose a certain technique, and and the influence of trigger points, and is it the primary pathology, or is it a secondary driver of their pain? And then we look at what happens as far as extrasegmental spread and expansion of the receptive field, and referred pain, and why some people have a widespread myofascial pain and their central nervous system becomes sensitized, and it's not just it's no longer a peripheral driver. Now it's more of a central nervous system problem. And we can't just address that with one tool. We can't just needle them and expect myofascial pain to be completely resolved. That's one component of it. Yeah,
that's right.
Great. So let's wrap this up now. Hopefully that's given people a lot of different perspectives and ideas about the similarities, and there are some, but also the major differences, and why both camps, both groups need to give respect where respect is due, because both modalities are hugely valid. We've seen a big rise in the popularity of dry needling over the last few decades, because it's become one of those things we understand better. Science has arrived, the research is evolving constantly. It's a pretty dynamic space. Then you've got a few thousand years of history of Chinese medicine, of it being used as the primary source of medical support for millions of people for literally thousands of years, and you can't diminish the value of that either. So, Tino, what would be your message to Chinese medicine practitioners out there, particularly the ones who are maybe a little bit hesitant or guarded around their ideas on dry needling, and maybe maybe don't even think that it's something that we should be practicing, or anyone should be using?
Yeah, so my message would be, would be pretty much to, I think look on both sides, like more education, really. So the more modern courses in Chinese medicine have a neuroscience perspective, and so they would already kind of have an understanding of that from a biomedical approach. So it'd be really listening to that a little bit more, and probably not feel as threatened, because I think a lot of it comes from, and maybe, I don't know, it might happen on both sides. And it happens with every profession, once, like with osteopaths and chiropractors, in terms of manipulation, that's a protected thing, so ultimately I think a lot of the resentment comes from, needling not really being protected. So I think they have to drop that idea, and there's no, dry needling is out there now. Like there's no reason to really build up more resentment about it and saying, these people shouldn't be needling because they don't have the understanding and whatever. Like, so drop that thought altogether and look at it from a neurological, a neurophysiological, biomedical approach, and look at what's actually happening there, like what that modality actually is doing, rather than what they shouldn't be doing.
Yeah.
And so it's important, I think, if education's on both sides of the fence, I think it'd be much cleaner, and the respect, so respecting both modalities and stick within your modality. I mean, most importantly.
Right. That sort of goes to both sides, like you said.
Yeah,
and I think there's another level to that, is also the fact that as a Chinese medicine practitioner or acupuncturist, your ability to treat different presentations is hugely,
it's huge.
Hugely broader than a dry needling practitioner. As a dry needler, we're going to treat musculoskeletal myofascial type pain primarily.
Correct.
With acupuncture, you can treat sleep disorders, hormonal imbalances, digestive complaints, fertility issues. We're not going to touch that with dry needling. So,
there's so much for us to play with.
Yeah, that's right. It's such a big playground. I don't think people need to be threatened. If someone is feeling threatened and they feel like the dry needling practitioners down the road are taking their business, what advice would you have for them?
Right. Yeah, that's a great question. I'm glad you asked that. Yeah. Come and do a dry needling course if you want, because often for an acupuncturist, when we're talking acupuncturist, right, often, and not including, say, herbal medicine. So for an acupuncturist, the bread and butter is usually musculoskeletal medicine, really. So for those practitioners, like, I can't strongly advise, enough, like, go and do a dry needling course, an accredited, like a proper dry needling course that teaches dry needling, so not the, muddied version that we were speaking about. Go and do it. If you want to practice musculoskeletal medicine from a Chinese medicine perspective and from my biomedical perspective, go and do a dry needling course. Easy.
Yeah, great. Well, you and I have both seen over the last couple of years a rise in the number of acupuncturists coming to do dry needling courses. You agree?
That's great.
Like, and which is brilliant. And I love having acupuncturists in my classroom when I'm teaching dry needling, because we can have these conversations, because we always talk about, okay, here's acupuncture, here's dry needling, here's the differences, similarities, respect for both sides. But when we can have an acupuncturist in the room adding their different perspective, and then seeing how they needle versus how we're teaching it in a dry needling course, and the differences, and the lights going off on both sides, and sharing of ideas. But do you see that as well? Like, when you're seeing more and more of that happening, like I am?
Yeah, definitely. And yeah, you always pick up on different approaches, and a lot of acupuncturists tend to be really grateful for understanding the understanding of different depths of tissue, where they might not do deep dry needling as often. So understanding that anatomy to a deeper level, I think, really improves their understanding of what they're doing, their reasoning, and also their safety.
That's great. Yeah, and safety is really important. Bo, in terms of like dry needling for an acupuncturist, and versus acupuncture needling. So so our Bible, so the Bible's typically accepted to be Deadman's. It's a big blue acupuncture book, like it's about that thick, you know, and you've pretty much got to memorize, you know, 3/4 of it. But, you know, so for an acupuncturist, it's every single point has a depth. It has a direction, you know, oblique insertion or a transverse or a perpendicular insertion. So, you know, so when we're finished memorizing this book, you know, we've got, you know, our repertoire of points that we use, and we know exactly where it is. We know exactly what depth, and we know exactly which direction to put it in. And so that's incredibly safe, you know, like for an acupuncturist. But when they start to step outside of that and they start to, you know, to needle these trigger points around lung fields in particular, or, you know, around neurovascular structures, then that's when it becomes dangerous. And they really need to know their anatomy. So safety is key.
Yeah, we often have that question in courses. What size needle do I use? Or how big's the person? You know, how much tissue do you have to get through? How much muscle bulk do they have? How much fat do they have? So it's really, you know, you have to integrate a little bit more of this critical thinking and understanding of your palpation, and then 3-dimensional visualization of what are my layers that I need to pass through, and what would be the appropriate angle if I go too deep to keep me safe from avoiding an artery or a nerve. So I think, yeah, that's certainly a really important part. You know, different body shapes and sizes might require different needle sizes and depths.
Yeah, correct.
100%, yeah, and that just goes to your earlier point, Tino, like saying that you had to memorize, you know, 3/4 of a giant textbook. You can't do that in a 3-day dry needling course. Nor will we ask you to.
And that's
but
only the
we'll ask you to.
location and you know the specifics in terms of how to needle. Then there's all that, you know, the point combinations and the energetics, and I mean it's huge. Like, you know, that's why it's a 4 or 5 you know, year course. In addition to the diagnosis and the, you know, it's a huge course.
Yeah, 100%.
There's no way you can water that down.
No, that's right. And that's the thing that everybody in the Chinese medicine community needs to recognize too with dry needling is a practitioner coming into a dry needling course doesn't learn how to treat trigger points or treat myofascial pain in that 3 days. They have most of that knowledge already. They're learning how to insert a needle, and they're revising anatomy that they should already know to be able to work with it in a safe and effective way. It's a skill set they're learning in 3 days. It's not a foundational understanding of modality.
Bang on.
And that's a skill set's easy to teach, but someone who's got a good, strong foundational knowledge. But you know, not everyone who does a dry needling course will come out of that course and have passed it. Like it's not like you just go and do it and you walk out and you're good to go. We don't pass everyone that does the course because not everyone has that foundational knowledge. So that's the key bit, the bit they get before they walk in the door. Chinese medicine, you've got 4 or 5 years. You've got hundreds of hours of clinical practice to build up under supervision. It's a whole system, vastly different to what we're doing with dry needling, which is much a more narrow approach. So,
correct.
Yeah, I think hopefully this has been useful. I'm sure it has for people who aren't familiar with Chinese medicine, or for the Chinese medicine practitioners who aren't familiar with dry needling, or maybe had a preconceived notion of one or the other. And I think the preconceived notion is often where the danger lies. And these conversations need to happen more often. It'd be great to have, you know, a panel discussion like this, I think, in front of an audience of both practitioners, and have questions answered by both sides in a group setting, and be able to, you know, workshop all of these things at some point. Would be a great thing to work through.
Yeah, I think so.
Yeah. Tino, Bo, anything more to
add? Not for me.
No. Great, perfect. Tino, thank you so much for your time today. This has been great. If anyone would like to speak to you or contact you in the future, what's the best way to reach out to Tino?
Probably, just my email address would be fine.
Okay.
And you have a copy of...
Yeah. I'll put that into the notes. So if anyone would like to reach out, they can send you a question or something. I'm sure you'd be happy to follow up.
Yeah, absolutely.
Always a pleasure, Tino. Thanks very much. Thanks for tuning in, guys. Have a great day.
Thanks, guys.
Thank you.